Who fancies some Northern Soul? Well, that was a bit pathetic, really. I thought there'd be a sing-along, a bit of dancing. Anyway, why did we play a bit of Northern Soul? Well, we played a bit of Northern Soul because we're going to listen to a bit of Northern Soul. Quiet! Shh. Thank you. Thank you so much. Yeah, so we played a bit of Northern Soul because we're going to be listening to a bit of Northern Soul. We're going to be discussing the Wigan Deal, which I think has been talked about at least 4 or 5 times on stage already. So we've been talking about it. It's been referred to, but what really is it? Well, we couldn't have 2 better people to describe the Wigan Deal, its genesis, what it is, how it's evolving, what it's achieved, than our 2 speakers, who I think are going to do a double act. Is that right? Fantastic. A kind of duet, a Northern Soul duet, if you like. So we have Alison Mackenzie-Folan, who's Chief Executive of Wigan Council, and Professor Kate Ardern, who's outgoing Director of Public Health at Wigan Council. Please welcome them.
Thank you, Matthew. I didn't want to dance. I'm too embarrassed and too shy, but I think that's the first time we've come on stage to Northern Soul, so excellent, thank you. So, thanks Heather for inviting us. It's great to be here. Kate and I have worked together for 14 years, so we've been on a bit of a journey together. Unfortunately, the 14-year journey we can probably only share in about half an hour today, so we'll do our best. I would point to the King's Fund report if you want to read that. There's a lot more information about the work that we've been doing in Wigan in terms of our citizens-led approach to health and care. So please read that if you get a chance. We're also running a session this afternoon, so forgive me for those who are coming to that session, but we'll get a chance this afternoon to go into much more detail. And also, if you're interested, please come to Wigan. We love to invite people to come and talk to us, for us to reflect and for us to learn too. So we love learning from others. So if you fancy a day in Wigan, come to Wigan and we can exchange views and reflections and hopefully learn lots together. Okay, at this point, I'll check the slides work. So I have to be, as the Chief Executive and Place-Based Lead, a bit of a walking advert, so forgive me. I'll do a bit of a Wigan. Who's been to Wigan? Apart from the fact that you all can't do Northern Soul. So we've got a few in the room. Sorry, I've got a light there, so I have to keep taking my glasses off. A few hands up. Well, come to Wigan now. You've had an invite. So we aren't just Wigan. We are 14 proud towns, and we celebrate all of them. A great location in the northwest and the heart of lots of music, but particularly Northern Soul. And many people who know Wigan we are an ex-mining community, but now we've got the most beautiful green spaces, so another reason to visit. Nearly as beautiful as here, and many of them are old mining spaces, and we've just launched a national nature reserve from some of those reclaimed mines, so it's absolutely beautiful. Rich industrial heritage, but also amazing sporting tradition. We are currently hosting the Rugby World Cup, and we hosted the Women's Euros. So we've got 2 great rugby teams, a brilliant football team, but really, really importantly, loads of grassroots sports clubs, and it's all about communities. And if we've got any of Greater Manchester in the house, anybody here from GM? Few? part of Team GM as well, so you can't talk about Wigan without talking about Greater Manchester. So we are 10 local authorities who work really, really well together in the Greater Manchester Combined Authority. So that's my walk-in advert for Wigan. A little bit about us in terms of our people and what we are doing to work with our people. We're a big council, so 320,000 residents. As you can see there, our population is ageing, and we do have lots of issues in terms of deprived communities. And we're a big Met in England, so one of the second largest council in Greater Manchester and the 9th in England. And I'm afraid to say that 231 million used to be a lot more, till about 40% was taken away from us through austerity, and we'll talk a little bit about that journey. And Kate's going to go into some of our adult health and care figures, but as you can see there, as a place working together in an integrated way with our NHS colleagues, the total budget is just short of 700 million. I'm not going to talk too much about the broader determinants of health, but one of the reasons why we are doing so much work in terms of that integration piece is because we know here, in terms of behaviours and the socio and economic factors, that's what really matters in people's lives. And that's what we've tried to do through the deal and through our integration work, and particularly now through the new ICS arrangements. Actually, in Greater Manchester, 8 of the chief executives are now the place-based leads, so it's the local authorities who are perhaps the conveners of place, really working closely with NHS colleagues to really start to work on these broader determinants of health. And also within Wigan, much of our work has followed the Marmot's 6 pillars, which I know many of you will know about in great detail. So a lot of the work and a lot of our thinking, which Kate will talk about, has been to mirror the 6 pillars. A big thing for us has been throughout the deal journey is to have the support of our elected members. We have a brilliant lead member, cabinet portfolio holder, Keith Cunliffe, who has also been on the journey with Kate and I and everybody else. And I don't think without that political support, without that political backing to take some of the tough decisions, to do some of the radical work, to do some of the innovation, we couldn't have done it without them. And obviously they've been making those big decisions. And they know our communities the best. They understand where communities have got major assets, and they really, really help in terms of understanding the picture. So a little bit about the deal. And in some respects, it was our response to austerity. And as I said, we were I think in the Institute of Fiscal Studies, when austerity started, we were quoted as in the top 3 of councils to have their budget most cut. Not trying to get into a competition about how much people have had taken out of the budgets, because you can see the figure of 170 million. So we made a decision to try and learn from the work that we've been doing over many years with Hilary Cottam. You may have read her book, Radical Help. She'd done a lot of work with us, working deep in communities, working around people rather than seeing people as units as needs. So we worked a lot with Hilary. We'd also worked a lot with Nesta on confident communities, so some Nesta innovative work about really understanding your communities. What does it take to really understand communities? And we also did some work with an anthropologist and some ethnographers who really helped us start to really understand what asset-based working was. And all of that learning helped us then say, well, actually, in terms of austerity, we can't just do a death by 1,000 cuts. We can't just start to slash services. We need to do something different. We need to change ourselves, perhaps from quite a paternalistic council, maybe a bit more old-fashioned, into something much different. So we started to bring all of these programmes together and worked on the deal. And essentially, this is about putting human relationships at the heart of everything that we do. And those really about trying to understand and get people to sign up to what does it mean to have better relationships? What does it mean to have better health? What does it mean to have a more sustainable environment? And how can you play your part in it and communities play their part in it? So we started to really articulate what this was with our population, with our residents, and essentially talk about it all the time, about how do we really change that relationship between a big council, a big public service, and the people in our communities and find better ways to do things. And we actually knew that all of our solutions were in our communities, amazing community groups and amazing staff. So if we could harness the power of our community groups and our staff, we could actually do things in a much better way, a much different way. And it's really been our philosophy all the way through, which is thinking about human relationships, thinking about communities, and how do you put them really at the centre of all of the redesign work, all of the transformational work, all of the staff culture and everything that we do. And just a few things on the principles. So I talked about the work with an ethnographer and an anthropologist. And what we did in Wigan, we really talked to our staff about what does it mean to have a different conversation? What does it mean not to go in there with a tick list of looking at people about what they can't do? Actually, if you chat to that person and know that they're interested in Spanish or art classes or sewing or singing, and you connect them to a community group, it means that they're going to have a much better life. So find out what people like and don't treat them as something that they can't do. And we scale that up. So we didn't just train a few people in adults in social care. We actually scaled it across the whole organisation and then across the whole partnership with primary care, with the hospital, with all of our NHS colleagues, and also with the community sector. So that was really about actually how do you go about having a different conversation? How do you know your community better? And we've got so many workers now who are community link workers, working in GP practices, working in hospitals. So it's really about actually how do you do that integrated piece to know your community, and how do we co-locate in a place close to our neighbourhoods? And how do you build that capacity? So actually, how do you commission differently? How do you step down some of your traditional commissioning, which Kate will talk about, and do a different type of commissioning where you build from the heart of your community? And really, really important in Wigan, and something that we've worked for many, many years on, is actually how do you give staff the permission to take risks and do things differently and not blame them when something goes wrong? So our staff have amazing capacity to know what is the right thing to do if we just give them the freedom to do that. And we've worked really, really hard to support our staff in terms of their permission to innovate, permission to take risk. Quick components, if you want a recipe for the deal, if you can't come and learn more about it or find out more about it and chat together, it's that narrative that's held us together and a real big belief. So it's not been a project in one part of the organisation or in the NHS or in the council. It's actually, we believe in it, Kate, don't we? It's something that we truly believe in. So it's something that's been part of us. It has taken leadership from politicians, from officers, from staff, from partners, and making sure that we get that sponsorship change, working through the cultures and those permissions, and really redesigning the system. And taking on board a lot of what Sultan and Dan said in terms of embracing the things that we can do differently through innovation and digital technology. And it was a great speech, Sultan and Dan, and lots to learn from the work that you're doing. And really, how do we then do different models of commissioning? Last two slides from me before I hand to Kate. These are not pictures on the wall in Wigan about, oh yeah, they've got some behaviours on the wall, laminated and stuck up. We chat about staff all of the time. I meet every new recruit that joins the organisation, and I talk to them about, well, so what does it mean to be courageous, accountable, positive and kind? And ironically, or perhaps it was meant to be, we introduced, Kate, didn't we, Be Kind just before COVID, because personally important, kindness in leadership is really important to me, and kindness and compassion in everything we do is important to me. So we had a chat and everybody agreed we should start talking about kindness more, and it was probably about 6 months before COVID. But the big one there is around courageous. So we're asking people to do things differently, and we talk about what does it mean to be these things to our staff. We recruit on these, we do listening to action sessions with staff, and we talk about it all of the time in terms of, so how am I going to be courageous, accountable, positive and kind? Yes. Two last slides. So two important other bits of the jigsaw or other bits of the journey is really strengthening community assets. And that has taken, there's lots of nice pictures of people we love there, Kate. But what that has taken is a big investment. So when we were going through austerity, it perhaps would have been easy to say, let's cut the traditional grants to community groups. Let's really sort of batten down the hatches. But actually, we reversed that decision and said, no, now is the time through the deal to invest totally in our communities. Those investments and those grants need to change into much more about giving the opportunity for our communities to take control, letting them come up with the solutions. And really, as you can see there through some of the figures, the economic impact and the social impact has been amazing by just those investments into community groups. Small investments, big investments, long-term investments. And actually what our community sector said to us, we feel like you're a council or a partnership that really believe in us. And without your belief, we perhaps wouldn't have even thought that we could do this. But now you're backing us. We really know that we can change people's lives in our communities. And that was probably the most important thing for us to hear, to say that we did believe in them, and we do believe in them, and it's really important that they do the work. So I'm going to pass on to Kate now. I think we've got some time for questions at the end, and happy to explore those. So Kate's going to go into a little bit more detail. Thanks, Kate.
Well, good morning, Belfast. Hey. Sorry. Good morning, Northern Ireland. Thank you. Thank you very much. Just to reiterate a couple of really key points that Alison made. Geography matters, be it physical geography and social geography. And we found out that never more so during COVID in Wigan. The 14 proud townships that consist of Wigan Borough, some of them go back to the Doomsday Book, much older than local government or the NHS. That's the geography that matters to the community. And we tend to, with professional networks and organisational networks, to impose a fake geography on communities. I think one of the big lessons for us in the Wigan Deal is to work with the history, the traditions, the geography that matter to local people. In other words, we fit around them, not the other way round. And never more so, and Alison will smile as much as I did, when the primary care networks came in. The NHS loves to have its own geography, doesn't it? It's often different to local government's geography. And it doesn't make sense to anyone else. One of the big leadership, I think, triumphs for Tim Dalton and our colleagues in the clinical commissioning group was to persuade all their colleagues, because we already worked in a twin township model based around the registered populations of schools and GPs that fitted with our 14 proud townships. So it's the way the VCSE sector, it's the way we organise services in the council. They persuaded all their GP colleagues to fit the primary care networks into the same geography. Very, very, very important. What Alison and I are talking about is not a sort of one-size-fits-all model. There is no such thing. And there is a sort of, I think sometimes, and Matthew will probably smile at this, certainly when you're dealing in the English NHS and Whitehall, a desire to look for the perfect model. There isn't any such thing. Every community, every borough has its own story. And I guess what we're sharing with you is our journey and some of the lessons and learning we've done from that. But it is up to you to do all of that hard work with your communities to describe your own narrative. And the conversation I was having last night with colleagues at dinner, we get a lot of very hung up on the statistics and the numbers in the NHS. But actually, to improve somebody's lung function isn't much good if they can't go out and do the things they enjoy doing. That's what actually means, that's what health really means to people. So at the heart for us of the Wigan Deal was to think about other places that had actually gone on this journey. And one of those was North Karelia in Finland. North Karelia in the 1970s had the world's highest rate of cardiovascular disease. It's been very well researched by WHO. What changed was the community went to the regional government and said, too many of us are dying of heart disease. They were spending loads and loads of money on it. This will upset any cardiologists in the room. At the high-end specialist treatment end, it was making not a jot of difference to population health. So the population and the regional government took the brave decision to shift investment upstream into whole societal, whole system prevention, not the odd lifestyle programme, but looking at the way transport was organised, education, food delivery, all the things that actually make up a healthy society. And that, in effect, is what we've tried to put in place in Wigan. So what we've tried to do is to incorporate the learning from North Karelia with our work, because that was the thing that was causing the poor rates of health. It's the single biggest cause of premature avoidable mortality in the borough. But we were also working with the Royal Society of Public Health on training community health champions. Because the reason people want to be healthy is not to save trolley weights in A&E. It's not to get down the elective waiting list. People want to be healthy because they've got hope, confidence, and belief in their own futures and that of their families and loved ones. In other words, this is about dreams, hopes, and aspirations. When I first went to Wigan 14 years ago, I used to hear a little phrase. We don't hear it anymore. And again, Alison will smile at this one. We used to hear a little phrase. I hate to say it, it always came from the health professionals. It's good enough for Wigan. Now, what they meant by that was not something they would have ever accepted as being good enough for themselves or their families. It's a bit like saying the poor will always be with us. There was a paucity of aspiration and therefore a paucity of lack of confidence in the community. You will never see that now. Keith challenged it, Alison challenged it, I challenged it, because that was simply not acceptable. The saying you'll hear now in Wigan is, only the best is good enough for Wigan. And that means who works there, in the way that Alison described, but also the aspiration around the communities. In other words, believing, trusting, and investing in communities is absolutely key. So we work with the RSPH to we now have over 23,000 community health champions in the borough, from little uns to old uns. And a number of them, particularly our drug and alcohol recovery champions, work through community detox as well. I think I've got the right slide. Yeah. This is just to say that, just to some of the quotes from people who are community health champions. We often forget, if you are a high-achieving graduate, I'm a double professor, but I was told at school I'd never pass exams and I'd certainly never get to medical school. So there you go. My headmistress was wrong. In fact, I think her actual words were when I said I wanted to read medicine at university were, "My dear, you will find that is impossible." Yeah, quite. I've been a doctor for 36 years, so there you go. But I think we sometimes forget. Yeah, there are those of us like me who are a bit bolshy and will say, "Up yours, we'll go and do it anyway." But for most people, somebody actually telling them they're a failure, particularly if it's done repeatedly, means they start to think like that. And one of the things we found through working in the Community Health Champions programme, which is very much that kind of empowerment, engagement approach, it's a level 2 qualification, so it actually helps us grow our own workforce, by the way, because it's entry level to health and social care, is that for many of these folks, this was the first time they passed an exam. You cannot begin to imagine how empowering that is for someone. They get to 40, 50, and they pass their first exam. The absence of praise. It's very important that we do that. Right. We click a right, there we go. The other thing we did was to work with colleagues from, as well as the Finnish example, some work from Seattle on Heart Start, so incorporating things like training in resus for kids as young as 7, 8 through to old uns, along with health improvement training as well. There are 7, 8-year-olds who know more about how to look after their hearts in Wigan than I did when I went to medical school. Admittedly, it is 40 years ago, but it's sort of just, I think, part of that empowerment and education is incredible. Start with the very young. Is really important. And we've done that through also working with the fantastic and inspirational Elaine Wiley on the Daily Mile. That simple concept she came up with as a primary school head. Nearly all of our primary schools do that. And our early years settings came to us and said, can we do this? Sort of the under fives. So they came up with the Daily Toddle. Brilliant. I've sold that one back to Scotland, by the way. Because they liked that idea. But the point is, it makes it fun, it's socially connected, it's getting people active, but it's doing it through the school curriculum. And we are a part of the young health movement as well through RSPH. And I can commend that programme to you, because that is something you can look at and adapt, for your own sets of circumstances working with that organisation. Have we made progress over the last 14 years? Well, when I first went to Wigan 14 years ago, every single health statistic was going in the wrong direction. I'd like to say it's still work in progress, of course, but we have seen some major changes in terms of health improvement, not least in terms of reductions in smoking. So we're down to around 17%. It's gone up slightly because of COVID, but it will come back down again, we know. We actually have the lowest routine and manual smoking class smoking prevalence in the whole of Greater Manchester. Yet even better than Trafford and Stockport, who are wealthy boroughs. So that says something around the targeting. We have got our teenage pregnancy rates down, fantastic. And our early deaths due to cancer and CVD have significantly reduced. And the King's Fund also found that when they looked at our work independently. We still have some significant challenges around adult obesity, which unfortunately has got worse through COVID, partly because our adult weight management service, Lose Weight, Feel Great, name thought up by the population, not by me, has run very much through face-to-face involvement of our professional sporting clubs in that, particularly in Men v Fat. And obviously, much of that activity had to cease during COVID. So part of the post-COVID recovery plan is to get back on track with that. What does it look like? Well, I wouldn't be a public health physician if I didn't show a few graphs. So here is our sort of update in terms of where we are. And what we've seen is a consistently upward trend since we started the deal. It took, I would say, around 3 to 5 years before we started to see the impact, but it has been consistently going up. And that, I think, you note in contrast with, for example, with England, where women's healthy life expectancy has come down. So it's actually got worse. So we have been bucking the England trend, which is quite an interesting dynamic for a former mining community like Wigan. A little bit of a sort of contrast with our neighbours in Bolton and St Helens, our geographical neighbours, but also statistical neighbours. Again, we've seen some COVID impact on this, but generally our trend in Wigan has been going upwards. Yep, I would just look at that. So if you like, if you are a sort of little girl being born in Wigan today, generally you will have a healthier life expectancy than our neighbours. And this is just to sort of show it as a sort of trend analysis. You can see you can see where we started off in 2009 at the left-hand side of the screen, and the fact we went up, and then we've seen that slight COVID effect, unfortunately. But again, you'd expect that in somewhere like the northwest of England that had a particularly bad COVID experience. Although, and I'm going to sort of just point out that Wigan's COVID excess death rate is actually lower than England's. Quite interesting that, given where we started off. So these are taken from the latest health profile. So that in this slide, you can see that for England, deaths from COVID, the excess death rate was 1.16. In Wigan, it was 1.12. So it's just slightly below. And when you think England encompasses a number of very different, very wealthy boroughs, particularly in the south of England, that's quite a significant finding. But it also helps to point to how we might bounce back from COVID. And I've just put here if you like, what my now successor, Rachel, will be doing in terms of post-COVID recovery. Sorry, I turned 60 in January, which is why I retired in July, as much as I love the job. See me afterwards for it's Clarins. I appear courtesy of Clarins and Andrew Collins, by the way. But I've just sort of put here where we're similar to the Northwest. So if you think about things like smoking prevalence, anxiety, happiness, interestingly, we're quite a happy borough. How that contrasts with the suicide rate and self-harm rate, I think is something that perhaps wants exploring more. And I suspect there is a very particular demographic that the suicide rates pertain to. And of course, you're looking at small number statistics there as well. Low birth rate, we do very well. Infant mortality, we've never had a particular challenge with. And I think very encouragingly for future health, that good level of development, and even our childhood obesity stats are reasonably good. They're not perfect and they do need some work on, but they are not the biggest challenge for us. However, that focus on recovery for adult obesity is what will be helpful in terms of pushing the healthy life expectancy back up. And we do still need to tackle smoking in pregnancy. So a couple of last slides from me. There we go. Oh, sorry. Have I got? Yeah. So, a couple of last slides from me. I think focus on Marmot. Very, very important. Think about not just his original report, Fairer Society, Healthy Lives, which absolutely drove the philosophy of our politicians in particular. Think about building community health alongside community wealth. That is absolutely key. That kind of investment in community skills, economy, and the sort of health building determinants. That kind of collaborative partnership where we have business, academia, the community, public services all working together. And it's very much about co-creation and co-design. And fitting the climate change agenda around that is absolutely a key determinant of health. So it's absolutely fits with this kind of philosophy and approach. And then my last slide, I think. Yeah. Oops. There we go. My last slide. Some key learning. Find the coalition of the willing. It won't necessarily be the usual suspects. The local medical committee, they won't mind me saying this, when I first went to Wigan 14 years ago, wouldn't speak to me because I was a woman. When I retired in July, they gave me a crystal vase saying how wonderful my leadership was. So there you go. But it's a very different grouping of leaders in the LMC now. Find the unusual people, the people who are radical thinkers. Infect The NHS with wellness. Stuart, our Director of Adult Social Care and Health, came up with that one. And yet the NHS is good at treating and good at sickness. It needs to get good at wellness. I think the colleagues who were asking the questions earlier said that. I think it's also about this whole societal, whole system approach. Learn from the early pioneers, the original Liverpool Fab Four, for example, Josephine Butler's work, the work of the Peckham Centre, which was the original model for the NHS. It wasn't an acute care model, interestingly. And then build on that with servant leadership. I've always said, I'm the person with the job title of being DPH. Every single citizen is their own DPH. In other words, be the expert on tap, not the expert on top. And that means letting go of power and control. And that, if you like, sums up the approach to citizen-led public health. Thank you.
Thank you, Alison. Thank you, Kate. So after a presentation like that, we can't possibly do things in a conventional way. So what we're going to do is take 5 minutes out of your coffee break, but I promise only 5 minutes. What I want you to do is just to spend the next 2 or 3 minutes talking to the person next to you at the table, just about what you've heard, to reflect on it. And then what I'm going to do is I'm just going to take 5 reflections, not questions. You can maybe come up and see Kate and Alison over coffee and ask them questions. I just want reflections from you as to what that presentation has kind of summoned up for you, what it's made you think, what it's made you want to do. So 2 or 3 minutes chatting to your neighbours. I'm going to choose 5 reflections that you can share.
Are you all right?
I'm fine. Okay, thank you, everybody. Thank you very much. As Kate just said to me, this seems to have generated quite a buzz. So I think it's a testimony to the power of what you've heard, that there was such a lively conversation. So I'm just going to pick, put your hands up, right, quick reflections on what you've heard, and actually I'm going to let Kate and Alison make one single final line to leave you with when they've heard your 5 reflections. So let's start here.
Does?
Yeah, we can hear you now. Tell us who you are.
I'm Stephen from South Eastern Trust. Thank you very much, ladies. It was lovely, especially like the one, be kind. Really, really, we need to resonate with it. There was a word that popped out to me, and maybe it will help in terms of scale and spread. The word champions. It struck us. And now South Eastern Trust are championing digital champions. I think it's a really great concept. Get on board, please. But I'd be interested to hear your thoughts on championing and how it helped deliver the outcomes that you very clearly articulated. And thanks again.
Great. So it wasn't a comment, it was a question, but I don't mind if you break the rules. It's fine. Just treat my instructions with utter disdain, why don't you? Yeah.
Hi, Jennifer from Elemental. I've been a massive fan of yours for a long time, and the thing that struck out for me was leadership. And I even just thinking in Derry, you know, we had during the City of Culture year, we had Aidy McGinley leading on regeneration. We'd Valerie Watts on the council. We'd Shona McCarthy, who was the lead on the culture company side of things, and anything. We just felt like anything could happen and anything was possible. So the big thing for my takeaway is just your leadership, watching you over the years, and it's just making me think about how do we get that same leadership here to achieve exactly what you have.
Thank you. Oh, yeah.
We have some reflection from the online audience as well. So the quote about being an expert on tap rather than being an expert on top has got lots of thumbs up and lots of claps. And Emma is saying, I love that quote. Dora's saying she loves it. Laura Collins is saying it's really inspired her towards citizen-led public health.
Great, thank you.
Hi there, my name is David McGinty. I'm from the Management Consulting Bureau. Thank you for your presentation. I thought your passion came across so much, right? And you really care about what you were doing for the people in Wigan. And it's more of a personal one. You said that the teacher said to you that would be impossible. So I think, you know, as I reflect on what Dan presented to us earlier, that's big and difficult, but it's not impossible.
Great, thank you. And then finally, and briefly. Here comes the mic. Here comes Heather. She's behind you.
Okay, thank you. I'm just reflecting on the distinctions between the councils here and the councils in the UK, and the fact that in terms of public health, that aspect is, you know, in there. And it strikes me, you know, the disparity of difference around the approaches of councils. Councils here have a coordinating statutory responsibility for their areas, but I see no evidence of any council actually taking on responsibility for coordinating and relating to health, education, you know, the key factors that shape our society. I really applaud the efforts in Wigan and would love to visit and find out more. But unless we get buy-in from councils here, I think it's going to be very, very difficult to move.
So I guess there's a point there about the importance of
we've a load
the
of
local democratic dimension.
Yeah, we've a load of councils coming for the masterclass later. They're on it. They're on it. I promise.
Okay.
Yeah.
So, great. Heather, you wanted to make a contribution? Yeah. No, that's it. Good. Right. Final. Leave one resounding thought in people's heads. Alison, and then Kate.
Are these on? Yeah.
Yeah.
I'll probably go back to what I said at the beginning, which was life's about human relationships, isn't it? And if we concentrate on that in lives, then hopefully we'll hang on to that hope and that compassion and that kindness.
Thank you.
I think one from me, and this is for all my fellow medics in the room. Use your power wisely, but with humility. In other words, that expert on tap is really important. Thank you.
Great. Okay. Well, thank you, Kate. Thank you, Alison. Do follow up what you've heard. There were lots of links in the presentation. You can find out a lot more about Wigan Deal. If you just could Google Wigan Deal, you'll see all sorts of interesting articles and research studies.